Hi, everyone. Thank you guys so much for joining us. I'm Dr. Hayley Hadden, to talk about canine parvovirus in shelters. I'm just going to give it a couple minutes because I can see that Zoom is still letting people trickle in. But we're going to talk about canine parvovirus in sheltering today. If you guys have any questions as we go along, if you want to drop them in the chat at the very end, I'll get them all together and we'll talk to Hayley about them. But you can also wait till the end and put in some questions at the end if you want to see as well. And Hayley, I'll let you take it away.
All right, sounds good. Um, so hi everyone. I am Dr. Hayley Hadden and I'm the medical director at Gigi's. Today I'll be sharing the results of two different studies that were performed at my shelter. I'll start with a retrospective study that examined the clinical efficacy of canine parvovirus monoclonal antibody in puppies who acquired the viral infection naturally. And then next, I'll talk about the results from a community-based case study where we examined whether deferring the intake of puppies before transport can reduce the risk of canine parvovirus infection and improve survival outcomes. So at Gigi's, our mission is to improve the lives of shelter dogs. We are just a dog shelter by combining cutting edge veterinary care with innovative sheltering practices. And these projects that we did reflect both responding to a real problem that we were seeing on the ground with practical data driven solutions. So before we jump into things, let me give you a little bit of background information on the organization that I come from. So what is Gigi's? Gigi's is a startup nonprofit founded in 2018. We are in the United States. We're in Ohio. Our 6-acre campus consists of 3 buildings, totaling about 26,000 square feet. And we have the capacity to house about 80 dogs at a time. We have an incredible veterinary hospital, innovative behavior programming, and an isolated parvo treatment center, which I'll talk a little more about in a bit. And we also have our own transport fleet to be able to travel to Southern Ohio to transfer dogs to our facility from our 6 partner shelters. And each of those partner shelters are lacking adoption numbers and resources. We're a team of about 30 driven innovators and dog lovers, and we're always looking for ways to scale and to grow and to continue to improve the lives of shelter dogs. All right, enough of that introduction. Let's talk about this first study. Clinical efficacy of canine parvovirus monoclonal antibody in naturally occurring parvovirus infection in sheltered dogs. So canine parvovirus, let me go back. All right, so CPV is one of the most devastating diseases that we face in shelters due to the vulnerability of our populations. It's highly contagious, targets rapidly dividing cells, primarily in the gut and bone marrow. And without supportive care, mortality exceeds 90%. With supportive care, survival does improve to 70 to 90%, but we all know that care is resource intensive. Until recently, treatment was limited to just supportive care, so fluids, antiemetics, antibiotics, and nutritional support. But in 2023, Elanco's canine parvovirus monoclonal antibody therapy became available, but its role in shelter medicine is still being defined. For puppies, the stakes couldn't be higher. We have high risk, high mortality, and high emotional impact for staff as well as adopters. We all know how scary that parvovirus can be in shelters. So, in many shelters, dense housing and the persistent influx of young, vulnerable puppies give the virus ample opportunity to spread quickly. As a non-envelope virus resistant to ammonia-based disinfectants, it can persist in inadequately disinfected environments for several months. Treatment of positive cases and management of those exposed dogs can be quite expensive and pose operational challenges So it does lead some shelters to opt for humane euthanasia rather than treatment. Even though the shelters can treat can struggle to have consistent isolation space to keep the rest of their population safe. So CPV isn't just a medical problem, it's a systems problem, and it's tied to intake, housing, and movement. So as I mentioned earlier, Gigi's is lucky enough to have its own parvovirus treatment center. So we call it our PTC, so Parvovirus Treatment Center. It's located in a biosecure building attached to the main medical and shelter facilities. We provide inpatient supportive care treatment, which includes IV fluids, dextrose, and KCL as needed. We also do nasogastric tubes, antiemetics, antibiotics, and appetite stimulants. This is all done based on a standard of care algorithm that we at Gigi's developed with a partnership with the Ohio State University College of Veterinary Medicine. Treatment's offered to shelter dogs only, and it is not open to the public, unfortunately. So in July of 2023, we added Elanco's Canine Parvovirus Monoclonal antibody treatment to our protocol for all dogs that entered our PTC. And then our patients are discharged once clinical signs have resolved and their stools yield 2 consecutive negative results via an IDEXX Parvo snap test, and they have to be done at least 24 hours apart. So how does CPMA work? After a single IV injection, ideally administered at the time of parvo diagnosis, CPMA will bind to the virus and interferes with its ability to bind to the host's viral protein receptors, which effectively prevents penetration of the host cells when the antibody is bound. In clinical trials in purposely exposed lab beagle puppies, the administration of CPMA at the time of parvo diagnosis significantly increased survival and decreased morbidity compared to a control group. So, as clinicians and scientists who had been using CPMA as part of our standard treatment protocol for several months, we wanted to know if CPMA worked as well to increase survival and decrease the morbidity in our puppies who acquired parvo naturally and at unknown exposure times. So here is the methodology that we use to find out. So we partnered with the Ohio State University College of Veterinary Medicine to perform a retrospective analysis of the electronic medical records for all CPV infected dogs at Gigi's. In total, we treated 131 patients. 63 of those received CPMA upon entrance into the PTC, in addition to the standard of care treatment algorithm. We analyzed the medical records between June of 2020 and May of 2024 to compare the CPMA patients to those who had been treated with the standard of care treatment alone prior to the time when we introduced CPMA. This was not a prospective clinical trial, and all dogs treated after July of 2023 did receive the CPMA. Some of those files, though, did have to be excluded due to incomplete medical records or treatments that deviated from that standard of care algorithm. We hypothesized that compared to the standard of care treatment alone, the addition of CPMA to the standard of care treatment algorithm would improve clinical outcomes of the patients and reduce the length of infection, as well as shorten hospitalization time. Between the two groups, we compared survival rates, days until daily stools had 2 negative parvo snap results, the time to resolution of clinical signs, as well as a daily clinical score, including the day of intake to the PTC. So clinical scores were made based on data that was consistently available in the medical records, and scores between 0 to 11 were tallied based on patient attitude appetite, degree of vomiting, and fecal scores. So if we take a look at this chart, a puppy with a dulmentation who had no interest in food, who vomited once in a 12-hour period, and had diarrhea that did not have any blood nor melena in it, would have a modified clinical score of 7. Now for our results. So before making efficacy comparisons, we needed to make sure that we were comparing apples to apples and that the groups didn't differ in morbidity at the time of admission to the PTC. So comparing scores using the Mann-Whitney test, it showed that a modified clinical score in the standard of care versus the score in the standard of care plus CPMA, they were not statistically different upon intake. So that was a good sign to us, and we were comparing those apples to apples. The survival rate for puppies treated with the standard of care treatment alone was about 78%, and the rate for puppies who received CPMA in addition to the standard of care supportive treatment was 82%, but statistically, those rates were not different. In surviving CPV-infected dogs, CPMA administration and standard of care significantly reduced the time it took for clinical signs to resolve compared to that standard of care treatment alone. As a reminder, the clinical signs we use to assess this comparison were vomiting, diarrhea, fever, and their willingness to eat. And again, dogs were not released from isolation until they had those 2 negative SNAP tests. In surviving CPV infected dogs, CPMA administration plus that standard of care significantly reduced the time it took to have those 2 consecutive negative parvo tests. Note that many of the dogs in the standard of care alone category did not complete data listing the 2 negative SNAP tests, so there were fewer dogs with whom we can make this comparison. To take it a step further and assess the effects of CPMA when given to relatively healthy puppies at the time of CPV diagnosis, we compared the time it took to have the 2 consecutive negative SNAP tests in dogs with a modified clinical score of 0 to 1 on intake. So this would be a pretty low score, so they weren't very sick. We did this in response to a discussion with peers who described that they were reserving CPMA treatment only for those who were the sickest of the sick dogs, mostly due to the financial concerns. So this analysis showed that compared to dogs who received the standard of care treatment alone, dogs who received CPMA had an even more substantial reduction in the median time it took to have those 2 negative SNAP tests. So in other words, dogs that received CPMA treatment who were not that sick when they were admitted to the PTC achieved a negative SNAP criteria even faster, having an even greater benefit than the group as a whole who had the 2-day median difference. Of those 63 dogs who received the CPMA, we did have only 1 adverse reaction. It was immediate after post-injection, and it was kind of like an anaphylactic reaction, but the dog fully recovered within an hour and actually ended up surviving CPV in the end. So overall, we saw a reduction in the time it took to reach a resolution of clinical signs, as well as achieve 2 consecutively negative parvo SNAP tests in dogs treated with CPMA. And the benefits appear to be even greater for dogs with the low morbidity at the time that they entered our parvo treatment center. But keep in mind, this was a retrospective study, which means we did have less control over exact parameters. And in shelter dogs with a minimal history, The exact time of CPV exposure and length of time they were infected prior to receiving treatment was unknown. So several cases did have that missing data and they did have to be excluded from our analysis, unfortunately. But while this was a retrospective study, the highly significant differences between the groups demonstrate a clear benefit to adding CPMA to a standard of care treatment plan. A faster resolution of clinical signs likely means fewer medications and shorter hospitalization time. So at Gigi's, the average cost per day of a parvo puppy is about $391, whereas the cost of CPMA for a 5 kilogram puppy is $220. So it doesn't take a mathematician to demonstrate a substantial cost savings because you are decreasing that hospitalization time. This may be especially true for puppies with the low morbidity at time of intake, and it supports the administration of CPMA as early as possible in the course of treatment. From a behavior and adoptability standpoint, achieving those 2 negative SNAP tests even 2 days faster meant 2 fewer days in isolation, 2 fewer days experiencing needle pokes and discomfort associated with the disease and treatment, as well as 2 additional days for essential socialization that they would not have had were it not for the addition of CPMA to their treatment protocol. So the wait and see approach may end up actually costing you more in the end from both a financial as well as a behavioral standpoint. We are still analyzing data for a cost of care analysis between the 2 groups, as well as measuring for daily clinical score differences. We hope that our findings provide justification for a robust prospective clinical trial to determine true efficacy over standard of care alone, as well as the use of CPMA in outpatient treatment protocols when hospitalization is not an option. Based on these findings, we at Gigi's have committed to the use of CPMA for every patient that enters the PTC, and we hope that those of you who are treating Canine Parvovirus will consider adding it to your approach as well, if you haven't already done so. So we're going to kind of shift gears a little bit here. And now that we've talked about CPMA and how it can help medically, behaviorally, and monetarily, we will start to talk about how we can potentially start decreasing the incidence of CPV in our own shelters. So as part of a strategy to increase live outcomes and reduce the risk of parvo outbreaks, many rural community shelters rely on the transfer of puppies from organizations that are lacking those resources in more and moving them into more densely populated urban and suburban areas. Receiving organizations supporting these shelters then take on that potential for parvo transmission, not only to other puppies during that transport, but as well as to their existing population upon arrival, as infected but asymptomatic puppies may already be shedding that virus. Adding the stress of transport further compromises these vulnerable populations and increases their susceptibility to infection. Gigi's is one of those organizations that brings in hundreds of puppies as well as adults annually from partner shelters. And when bringing dogs into Gigi's from partners, dogs are transported in crates via a 2018 Ford Transit van. And we follow a stress minimizing transport protocol that uses classical music, appeasing pheromones, and palatable treats. Small littermate puppies are transported in the same crate as long as each puppy has enough space to fully turn around, stand up, and lie down with their legs extended. Puppies are handled following the ASV guidelines for standards of care in animal shelters for biosecurity as well as transportation practices. Any dogs that show clinical signs of canine parvovirus, either at the time of transport or after they arrive to Gigi's, have their stool samples tested via an IDEXX SNAP parvo test. So we don't test everyone upon arrival, just those that are showing clinical signs. They are tested immediately, and if they are positive, they're immediately moved to that isolation in the parvovirus treatment center and treated according to that standard of care inpatient supportive therapy, as well as Elanco's CPMA. If a partner reports that a puppy is showing clinical signs of and testing positive for CPV on days where we're not regularly scheduled to visit them and transport dogs into our facility, we do make a special trip to transport those dogs to our parvo treatment center as quickly as possible. And as long as it's not super late at night, it is typically done within the same day. One of our partners with the greatest population and veterinary care needs, including parvovirus treatment, is Lawrence County Animal Shelter. So Lawrence County is an open admissions municipal dog shelter near the Ohio-Kentucky border, and it serves a local community of about 58,000 people and has a poverty rate of about 19%. This shelter has the capacity to house about 20 adult dogs and 4 puppies or litters of puppies in their designated puppy room. And in 2023, just to kind of give you a perspective of how many dogs we're transporting in, we took in 251 dogs from this shelter alone. Between January and November of 2023, the incidence of canine parvovirus infection for dogs housed at Gigi's was just under 2%. But during the months of November and early December, we noticed a spike in infections, and most of those were developing in dogs transferred in from Lawrence County. Our survival rate also took a steep dive from 93% in 2022 down to 72% in 2023. This then triggered further investigation and an intervention was launched. So our solution was to drastically shift the transport protocol for the intake of Lawrence County puppies with the goal of getting as many homeless puppies out of that county as quickly as possible. We increased our transport frequency from twice a month to once a week, and we prioritized dogs under 6 months of age. We also asked the shelter administration to defer their intake of all puppies to our Monday transport days. So this meant that anyone who sought to surrender an unwanted or stray puppy, they were asked to maintain possession until our next transport day. That way, puppies went directly from the community member's car to the Gigi's transport van without ever setting a paw in Lawrence County, when and if possible. For those puppies who were unable to be deferred, they were bathed upon arrival and they were quarantined for 7 days at Gigi's, since the vast majority of those dogs that we have had break with CPV have started showing clinical signs within about the first 7 days or so. So did our new protocol work? And here's what we did to find out. We conducted a retrospective review of our electronic medical records for all puppies transferred from Lawrence County to Gigi's from the start of the outbreak, which was November 6, 2023, through 2 months of the puppy deferment protocol, which ended February 20th of 2024. Our primary objective in looking back at this data was to determine if the protocol was effective at reducing the incidence of CPV puppies from Lawrence County, as well as improving the survival rates for those infected. So we needed to justify the diversion of resources away from other partners and towards Lawrence County with these weekly, often enormous, like I'm talking 20 to 30 puppies at a time, puppy transfer, and determine if it was a practice we should continue. Secondary objectives were to assess for any factors that might be associated with developing and or succumbing to parvo infections, such as intake type, the time of diagnosis, were they housed in the puppy room, and their vaccination status. Puppies were categorized according to their intake date. The non-deferred category included puppies who were transferred to Gigi's between the start of the spike in parvo infections on November 6, 2023, and the date of the protocol change, which was on December 17th of 2023. All the puppies in the non-deferred category were housed in the Lawrence County Puppy Room between 1 to 14 days prior to being transferred to Gigi's in one of our bi-monthly transports. Puppies in the deferred category were transferred to Gigi's during the 2-month time period immediately following the protocol shift, starting on December 18th of 2023. So this is where we'd ask those community members to hold on to any unwanted or stray puppies until the next weekly Gigi's transport. Please note that not all community members were able to maintain the possession of an unwanted puppy. But in these cases, so we actually only had 2 of those, the puppies were housed in the puppy room at Lawrence County until the next pickup, but they were still analyzed under the deferred category due to their date of intake. So in total, 160 dogs were transferred from Lawrence County to Gigi's during the study time frame. 19 of those dogs were older than 6 months, so they were excluded from analysis, which left us with 141 dog records for evaluation. 38 of those fell into the non-deferred category, and 103 fell into the deferred category. And I also want to make a special note here that just within the 2 months of the deferral program, we were already at 40%, so 103 out of the 251 dogs of our total intake from 2023 from Lawrence County. So at the very least, we were helping get more puppies access to care in a low resource community. The incidence of parvo for puppies transferred in from Lawrence County when the protocol had puppies housed in our rural partner shelter prior to transfer was 47%. So 18 of the 38 puppies transferred during that time developed infections. During the first 2 months after the protocol change, when the community was asked to defer intake and maintain possession of unwanted puppies, the incidence dropped down to 9%, with only 9 out of the 103 puppies developing CPV. So I'm just going to repeat that again because it's amazing. CPV incidence went from 47% to 9%. So 9% is definitely still high, but I'll take that any day over the basically 50% that come in. Our survival rates did increase from 72% before the protocol change to 89% during the 2 months following the protocol change, with 13 out of the 18 puppies in the old protocol surviving and 8 of the 9 puppies in the deferred protocol category surviving. This increase, though, was not statistically significant. I'll also say that the 1 puppy who did not survive in the deferred group did present in lateral recumbency. So that indicated to us that the disease was likely in advanced stages and the puppy already had a grave prognosis upon presentation. We do suspect that this increase in survival was also due to catching clinical signs earlier and being able to start that treatment right away. Our secondary objective, which looked at other factors associated with CPV infections, revealed some interesting findings as well. So regardless of intake date, puppies listed as stray on intake to Lawrence County were significantly more likely to develop parvo infections than were owner surrender dogs, with 20 out of 64 stray puppies developing CPV and only 7 out of 77 owner surrendered puppies developing CPV. We didn't really find any significance in vaccination status, as there were multiple puppies who had no vaccines, as well as puppies who had 3 vaccines, and they all became clinical and tested positive for Canine Parvovirus. As far as the puppy room, though, I'll get to that in just a little bit. So, as I mentioned previously, there were two stray puppies whose intake to Lawrence County could not be deferred until the Gigi's transport day due to community members being unable to maintain that possession for any duration of time. Unfortunately, both of these puppies did end up developing parvo infections within a few days after being transported to Gigi's. So, if we look at differences in parvo infections, regardless of intake date, and compare puppies who were housed in the puppy room at Lawrence County to puppies who were housed and cared for by local community members, the incident goes from 47% to that 9% comparatively. Overall, regardless of intake date, puppies who had been housed in the puppy room at any point prior to being transferred to Gigi's were 13 times more likely to develop parvo infection. So this indicated to us that that puppy room at Lawrence County was likely a canine parvovirus hot zone at that shelter. In regards to survival, we discovered that the timing of parvo diagnosis was significantly correlated with survival. So, as you can see in the first pie chart, only 3 of the 9 puppies showing clinical signs and testing positive for canine parvovirus prior to being transported survive, while all 18 puppies who developed clinical parvo after being transported to Gigi's, most within about 2 to 4 days, ended up surviving. We suspect this difference was likely due to improved staff recognition of clinical signs, as well as our ability to start that treatment immediately after diagnosis. While we were impressed with our overall findings, there are a few limitations to this study. So data were analyzed retrospectively between those 2 separate but consecutive points in time. There may have been other factors that contributed to that reduction of incidents, such as natural outbreak resolution, seasonality, or improvement of the sanitation habits by the Lawrence County staff. That said, a 9% incidence is still substantially higher than the 2% incidence that was reported by DeGangi et al. In 2021 for puppies relocated between shelters. At the same time as the deferment shift, we did investigate Lawrence County itself to make sure they were following those appropriate cleaning protocols that we had set in place. The protocol that this shelter uses are the same ones we use at Gigi's. So after removal of any organic debris, 1:16 dilution of rescue is used to foam down the entire kennel, and then that kennel is scrubbed down. We then allow the rescue to sit for a 10-minute contact time before it's rinsed away with water, and then the kennel is dried. Lawrence County does only have the equivalent of 2 full-time shelter employees, which includes the dog warden. So they do rely heavily on volunteers and community service workers. Unfortunately, this does mean a lot of new faces and turnover, so it can be difficult to make sure that everyone is being consistent with those protocols. It was found that some members were spraying on the rescue, scrubbing, but then they immediately rinsed off that rescue of the kennel instead of allowing it to sit for that appropriate contact time, which is so important. This was addressed with the shelter director, who did follow up with staff and volunteers to make sure that everyone understood those protocols and they were following through with them. Both study groups had relatively high survival rates, and there were likely too few infections to detect a difference once that protocol changed. We do need to have a more even distribution to see the precise impact of the protocol on long-term outcomes, though. Measuring survival over a longer period of time may yield a significant increase with that protocol change. So, in conclusion, deferring the intake of puppies in combination with providing more frequent transport opportunities successfully reduced CPV infections in this population. Our results suggest that housing puppies within the Lawrence County did put them at risk of contracting canine parvovirus. We propose that minimizing the time young puppies are shelter housed is a crucial consideration for organizations taking in dogs from shelter partners with low access to veterinary care and high risk of infectious disease. Local community members do appear to be willing to care for them for a short period of time at least and deliver them directly into the hands of the supporting partner organization later. Similar protocols could help other organizations manage existing outbreaks, and proactive deferment programs during known peak parvo seasons could also help preemptively mitigate those future outbreaks. Such efforts not only prevented animal suffering and potential loss of life on both ends of transport, but it also kept operations running efficiently and effectively without the hindrance of those lengthy quarantine times and movement restrictions for those CPV exposed dogs. So I just want to thank you all for the opportunity to present today. And our findings for our second study were actually published earlier this year in the Journal of Shelter Medicine and Community Animal Health. So if you are interested, this QR code should take you right to that open access article. So
Thank
what
you.
questions do we have?
Thank you so much for your time presenting that to us. If you guys have any questions, you can put them in the chat and Dr. Hayden can take a chance to answer. While we're waiting for people for any questions or anything like that, maybe you can share what some of the bigger barriers were to using the CPMA, if you experienced any, or was it easy to bring into your protocol?
So it's pretty easy to bring into our protocol. When we started, it was a difficult drug to kind of get, but it is more readily available now. They do have a better supply in stock now. It is quite expensive though, so you're looking kind of at cost for 1 ml is about $250. So it does get pricey, but again, if you're using it right away, you are shortening that hospitalization length. So you're saving time, socialization, medication, all of that. So it does end up saving you in the end. It's just an upfront cost that's a little more expensive.
Linda's asking, can you talk about the challenges and rewards of publishing from a non-academic setting?
Yeah, so this was actually my first publication. So it was very, very stressful, but it was something that I wanted to do. And we kind of already had made that protocol shift. We already had all the data and everything. So if you have all of that information and you're seeing a difference, why not try? I mean, the least publishers can say is no, and then you move on. But if they say yes, you could really be impacting the world of shelter medicine. So I think it's at least important to try.
Linda says, congratulations.
Well, thank you.
Out of curiosity, in compiling all of your medical records to do that kind of publication, does it make you think about how you keep your medical records differently now? Because I know when we've looked at studies previously looking at medical records, the medical records are there to relay patient information, but that sometimes doesn't mean that they're perfectly suited for analysis. So do you
Yeah.
guys do think about that differently now after this?
Yeah, so we did, especially when we first started. So we opened our treatment center in 2020. So, and it was the kind of the first time any of us had really worked a lot with treating parvo because our facility did humanely euthanize any parvo infected dogs before to protect our population. But now with the treatment center, that was I am so sorry. I forgot your actual question.
Just if you think about how you put data into your database now
Yeah.
after
Okay.
the study.
So since it was the first time, uh, doing all of that. Our records were not as organized as we like. So we went in and kind of made a template to make sure we have all of those categories that we want to keep track of. So that way we can just go, okay, here's our Parvo template. Yep, I need to make sure I'm documenting all of these things.
Absolutely. We have a couple more questions. So Paige is wondering, do you test every puppy on intake or do you only test symptomatic ones?
So we only test symptomatic ones because you can get those false negatives or false positives, as well as false negatives, actually. But we, especially since prior to this, we were euthanizing those puppies. We didn't, if they weren't actually infected, we don't want to euthanize those guys. But now, I mean, still moving, if we were to test one, it tests positive and still moving it into that our treatment center, that can still obviously cause some issues. You're exposing even more to that dog and things like that. So we do not test everyone on arrival, just those showing clinical signs.
They're also wondering if you vaccinate every puppy on intake on arrival, even the ones that were in deferred. So did you vaccinate them in the parking lot before they arrived at the center?
Yes. So our partner shelters, we do provide them all with vaccines. And one of our expectations in doing that is for them to vaccinate upon arrival. So they would ask, okay, since it's being transferred straight to you guys, do you guys want to vaccinate? And we're like, no, go ahead and vaccinate on right before they're getting on that bus and then send them our way.
Perfect. And so another person was wondering what was the vaccine schedule for the puppies in your study? So I guess did it differ between each puppy because some of them are being deferred and coming straight to you, and some of them are presumably being vaccinated at the other shelter. So did it vary between them?
Yeah, so we tried some community members, weren't able to make a lot of our, let me start with we had Lawrence County kind of call the potential surrenderers, or they would call in. They say, hey, I have a puppy. And they're like, great. Can you bring it in? We'll vaccinate it. And then if you can hold on to it until this transport date. Some of those people were unable to do that. So they did get vaccinated as soon as they came in. Otherwise, they had a every 2 week vaccination schedule.
Mary in the chat's wondering if you could share the protocol dosing schedule for CPMA. She was trying to look it up.
Yes. How would you like me to share that with you? It's about, I think it ends up being 1 ml IV per 10 pounds. It's around that. But
If you
I
email
can,
it to me, I can also share it with everyone who registered. I can email it.
yeah, I
Give
can,
them a resource thing if you like.
let me see if I can pull it up real quick too.
And Mary just was clarifying. She was just wondering how many doses it was.
Oh, how many doses? It's just one dose, one IV dose.
Thank you so much for your time
Yeah,
coming to talk with
yeah, of
us about
course.
all this and what you guys are doing at your shelter. Alinda had a question. Alonco told us that CPMA is coming to Canada early in the new year. Not a question,
Ooh,
statement. Very excited.
exciting.
Yeah.
Yep. So make sure you use it right away. Don't wait. It will have a big impact for you guys.
I'll just give it another minute in case anyone's frantically typing as we're answering those questions. But thank you so much. It was really insightful and it's great. Obviously, with CPMA not being up here yet, it's nice to know what you guys are doing in the
Yes.
US so that
Yeah.
you can be prepared and jump on that as soon as it becomes available. It
Yeah.
looks like that's all our questions. So thank you so much for your time.
Thank you guys. Have a good day.
Bye.